Welcome everybody. Again, my name is Russ Derry. I'm the Director of Education at Epilepsy Foundation of Michigan. And today's Learn and Share conference call is on assistive technology for cognition. And we're very pleased to have with us Dr. Michael Wolff, who's a pediatric neuropsychologist with BRAINS. And I'll let you say what that acronym stands for. But if you could just briefly introduce yourself, Dr. Wolff, and give an overview of your experience and some of your clinical and research interests, and also your interest in this topic and your experience working with patients with epilepsy, that'd be great.
Well, thank you all for joining in on the conversation today. But I appreciate you taking some time to listen in, to ask questions, and to understand assistive technology a little bit better here. I'm a pediatric neuropsychologist at a group called BRAINS, which stands for Behavioral Resources and Institute for Neuropsychological Services. We're a multidisciplinary group in Grand Rapids that provides not only assessment, but we have occupational, physical, speech therapy, we have neurofeedback and counseling, part-time psychiatry, neuropsychology, and some other ancillary services all in one location to try to provide the best benefit for patients so that they can work with a group of professionals locations instead of at multiple locations where it can sometimes be hard to coordinate medical records and treatment. So just in Grand Rapids, I'm from Frederick Meyer Gardens, for those of you who are familiar with Grand Rapids. My experience with epilepsy has really been a progressive approach throughout my tenure as a neuropsychologist. Started training out in the Los Angeles, California area, and started working in the Epilepsy Center at what used to be Augustus Hawkins Hospital and King Drew Hospital, out there in their epilepsy units, looking at some of the water testing and lateralization, brain function. And from there, I've always remained interested in epilepsy, trying to understand it from a medication standpoint, a functioning standpoint, and then obviously the neuropsychology of it. Which eventually led Russ and I to be connected and presenting last year on a panel discussion at the Epilepsy Association regarding epilepsy and interventions and how to understand it from a broad range of panelists. And so it's a challenging to understand, as all of you know, because electrical currents can cause lots of changes in the brain as well as chemical changes, which are interesting, especially unmanaged epilepsy.
So let's start by just you talked a little bit about what you do at BRAINS, and then if you could also just kind of introduce us to the concept of assistive technology for cognition. What exactly does that refer to, and what does that term mean?
Right. When we're looking at the concept of assistive technology for cognition, we're really talking about using any type of application, computer technology, or other device that has been used to try to make the skills that you might be struggling with your epilepsy to be easier for you. Essentially, when we're talking about assistive technology then, we're talking about any supplemental aid outside of medication or surgery that might make it easier for anyone who has a disability to function better and find ways to compensate to be more independent in their life.
Okay, great. So let's start.
That's what we're looking at when we're talking about assistive technology.
Okay. Let's start by talking about some of the most common cognitive functions that assistive technology can help with, and then maybe for each cognitive function, like memory, for example, or attention or that type, or language difficulties, if you could talk about maybe an example of a technology that might help with that particular function.
Sure. For this, I think we'll start out with memory, because that seems to be the one that is the biggest problem for a lot of individuals, is remembering your appointments, remembering what you're supposed to do, remembering to print things off. And so memory is one of the really big difficulties that we see with a lot of people with epilepsy. And we have to break memory into two separate factors. We have to look at long-term memory and short-term memory. Short-term memory, when we talk about that one, I'm going to be referring to what you remember in like 30 seconds or less. And so it's not something that you have to hold on to. It's just something that you have to remember long enough to remember to either write it down or to do that action, such as ask you guys to go to your room and grab your coat. You know, by the time you get to your room, I want you to remember that you're there to get your coat. And unfortunately, sometimes with epilepsy, even short little tasks like that, we might get to the room and go, oh, man, what was I here for?
Definitely. It's happened to me.
One of the things that this old technology, and it's still technology today, and that's something that we refer to as Post-it notes. I know most of us don't like to think about Post-it notes as being technology, but they certainly are. And so if you're an individual who has that short-term working memory problem, sometimes it is okay, a low technology resource is Post-it notes. And just write it down, hey, I'm going to my room, I'm going to get my jacket. And I know that sounds strange, but that's a very viable low technology resource. Newer technology resources now, you either can have watches or you can have a pendant that you wear around your neck that are a little bit easier to carry around and they're more convenient. But you can actually dictate in an idea that comes to your mind. And if you know that you're someone who is prone to forgetting by the time you get to a particular location, the kitchen, your room, you can actually dictate in very quickly saying, I'm going to my room to get my keys, or whatever it is. And by the time you get there, if you have forgotten, you can hit the little playback function for a short message, and you can hit that button and it'll say, oh, this is why I was coming here. And so it's pretty convenient if it's part of your watch or the neck pendants that have voice recording functions to them. And that's probably the most convenient thing to either have in your pocket, on your wrist. Some people will wear them similar to a car alert pendant that you wear around your neck like a necklace. But either way, having it readily accessible is one of the best ways to deal with that short-term working memory issue.
Do you know about how much something like that would cost?
They range in price depending on how sophisticated you want it to be. There are some older models out there for watches that can record voices for about $29. One of the highest tech options that's out there on the market, although it's still not that expensive. If you're a person who has gotten comfortable carrying around a smartphone or an iPad, so if that's something that you normally have on you or that you always know where it is, there's a product now that's being made, and it's being made by Yanko Design, but it's a sticker that you can put on any commonly used object, your keys, your wallet, your purse. And what it is it's an electronic tracker that the sticker has within it. And you can then, in your iPad or your smartphone, put what that device is. And your iPad or smartphone will detect it. And then you can say, okay, well, sticker number 1 is my keys. So at any point in time now, if you lost your keys, you can take and pick up your iPad or your smartphone and push in, where's my keys, and hit that key button. And it will bring you within a meter of where that object is. And so if you do commonly lose things that you need for functional abilities, it's a good way to go about it. And I don't think that that's too expensive either. I think the stickers are like $19, $19.99. And then there's a software application, and I'm not sure how much the software application is, I'm sorry. So those are working memory interventions. They're either little quick recordings that you can wear and have on your person like a watch, or a pendant or something in your pocket. Or if you're losing things all the time, you put it down and you've lost it. These stickers that are made by Yanko Designs with a little microchip in them that can program to an iPad or a smartphone is also a really good locator idea if you are a person who doesn't have that organization, doesn't have that consistency. Or, if you're like my wife, she changes purses so many times. And so she's got to have her black purse or white purse, and then she's got the green thing too. She'll sometimes leave things in one purse over the other, and she'll lose stuff like her keys all the time too. And so it's a good option if you are switching things up a little bit to allow you some flexibility without losing some very important things that you need in your life.
Excuse me, about that sticker, Yanko Design, how would you get that and about how much would it cost?
I think the last time I checked, and I've only had one patient that I've worked with this type of intervention with, it was $19.99 for like 15 stickers. the little microchip in there. And then the patient can tell me how much it was to download the app.
Hi, this is Chris Randolph. Can I come for a second here?
Yep, go ahead.
This is Chris Randolph. Are we going, just because time is at a premium, are we going to eventually get to a conversation about, like, learning disabilities and stuff like that in school?
Yes.
Yeah.
Okay, I just want to, I feel like we're spending a lot of time on this little thing here. I'm not trying to be rude. I'm just noticing time's at a premium.
No, absolutely, absolutely. So let's move on to some other devices and other approaches or examples of assistive technology. And Dr. Wolff, I think you had some others to discuss.
Yep. So let's go to long-term memory here. Long-term memory, being able to remember where something is anywhere after 30 seconds, all the way up to days, weeks on end. Being able to remember where you went, what you did. Did you take your morning medications or did you not take your morning medication? This again is going to go to computer tech. Well, low tech first. A memory journal is a great idea, and it's still tried and true. Write down what you did. If you took your pills in the morning, having a pencil and paper or pen, whatever, journal available so you can write it down. If you do not have access to a computer or other technology, it's still tried and true. Write down where you went. So if your caseworker asks you or if your doctor asks you, some people need to write down their menus. If you're on a ketogenic diet, again, pencil paper is okay. The evolution to that is obviously smartphone technology and iPad technology. And if you have those, you can make your life very easy. There are several functions out there, and one of the programs I like to go to is ablelink.com, ABLE-link.com. They have a program out there that allows you to take any of the most common routine things that you do. They can associate a picture with it, or you can put it in verbally, so it can have a voice recorder to it, but it'll make a checkoff list for you. And with that checkoff list, you can now take, instead of having to write everything down, you can literally within 30 seconds or less, put little check boxes in to say, I took my meds, this is what I had for breakfast, and it stores that information. So if you go to your doctor's office and they're asking, did you go to that appointment? Are you following your ketogenic diet? You have the most common foods that you're supposed to be eating in that. They can pull that data right from the application to see how you're doing and monitoring that. So even if you forget to tell someone what you're doing, it can be readily accessible. So it's a really nice technology that they have developed, but several other programs are there. It also allows you to create your own schedule. And so when we look at the Microsoft Outlook, which has been around forever now, you always have to type things in, but then you can put it as a repeating appointment. And with these new applications through ABLE, it allows you to put it in voice, picture, or written format, and it will have alarms for you. And you can have any number of hundreds of alarms to turn on and turn off. We also now have pillbox alarms. I'm pretty sure that some of you are familiar with those. If you have to take your medication, you took your morning dose, but you always forget your afternoon or night dose, a pillbox with an alarm, it's called a pillbox alarm, is a good option too. They're actually built into the pillbox themselves, so that they will set an alarm, which means you have to go to your pillbox to shut that alarm off. And that's a good way to remember to take your medication throughout the day if you need to do that.
Doctor? This is Karen Gooding. I'm with the support group. We brought that up at one of our meetings, but people at our support group there in Detroit were wondering about insurances covering that.
It depends on your It depends on your insurance. In some cases, some medication companies might be approached, and you could ask them to see if they'd be willing to sponsor that as something for your patients to try too. But to my knowledge, most insurance companies, unless you've been involved in an no-fault accident or have some waiver, probably won't cover that. But the pillbox alarms at this point in time can be found for about $19.
Okay. I have a question.
I guess just before we move on, because that was a question I was going to ask later, is just in general, as far as assistive technology for cognition, does health insurance tend to cover it? Does it have to be a device that is exclusively for assistive technology? For instance, like a smartphone obviously has all kinds of entertainment and recreational uses and other things. So would insurance cover something like that, or would it have to be a device that's explicitly for assistive technology for cognition? And then also, do schools if you have an IEP, would a school cover that type of device? So if you can talk a little bit more about that, that'd be great.
Yep, that's a great question. And we'll start with the school and the child issue first. If you have a child with epilepsy who would benefit from these assistive technologies, more often than not, you can work actively with the school to get an iPad or a smartphone technology that can go along with them a little bit more easily. And that can be built in irregardless if that same iPad or smartphone is used for other purposes like entertainment or texting. It serves a vital role for those kids and adolescents, and that can be covered as part of an IEP. Now, the trick is sometimes with the IEP, depending on how it's written, they will only allow use of it during the school year. So now let's say you have an iPad that's really working incredibly well for a child. If they're not in an all-year-round school program or in a program that allows them to use that through the summer, you now are disabling them for 3 months because they're just getting comfortable with it. So typically you want to write into the school to say, can we use this technology and have it written into the IEP for year-round use? Okay? The other option to do when you're working with the schools, when we were looking at assistive technology, the first thing is have you tried low-tech techniques? Because lots of times you have to demonstrate that you've tried something else that's not nearly as expensive or sophisticated first. And if you've documented that those have not worked, but you've documented that you've used those as consistently as you could, it moves you closer to the direction for that school to be more willing to use assistive technology with computers, smartphones, and other things like that. You might have to take some time. It might take, 3 to 6 months. But document, you've told us to use this visual schedule. We're constantly losing it. We're constantly displacing it. My child can't write very well, so they can't take the notes themselves, and we're not always home to do it with them. Document the pitfalls of some of those low-tech types of things so you can then justify why you believe a high-tech solution is an option. And most districts, especially for bigger districts, have to have access to an assistive technology center or a contract with an assistive technology center where they will allow the students to go to be evaluated for assistive technology use. Now, if you're an adult, the game changes. If you're an adult, this goes to your health insurance policy. If your seizures are from an auto accident, it'll go to your health insurance and possible auto insurance as well, or to things like Medicare and Medicaid. There it's a little bit harder. It is not impossible for assistive technology to be granted under a health insurance formulary. Usually you need to ask for a single case exception to an insurance provider. So you have to call in to the number on the back of your card. You have to ask them who you should talk to request a single case exception because it's not covered as part of your routine policy. And then you'll get a case manager on the phone with you who will ask you why do you need a smartphone, why do you need an iPad. And you have to justify why this would help you and how it would help stabilize your medical well-being. And so let's say that you keep going to the hospital because you forget to take your medications all the time. At that point in time, they may be willing to consider a pillbox alarm or a smartphone or a watch. Because at that point, it's cheaper for them to possibly take home, more so than it is for them to have you keep going back and forth from the hospital as a result of side effects from going on and off the medication. You do have to call and ask for a second.
Just wanted to interrupt. Someone is making, there's some noise, background noise. Can I remind everyone, please, to mute your phone if there's any kind of background noise? Again, to do that, it's *6. Okay. Sorry, Dr. Wolff.
It is possible, but it is hard. The other option when you're an adult is to talk to your accountant to find out if this is something that would be a durable medical device that could be written off as part of your tax. And for those of you who have the financial means to be able to buy that and can use a tax break, If your doctor typically writes a prescription saying that this is a medical device, whether it's a phone or a computer or whatever, that could be useful to help stabilize your medical condition, in most cases that can also be used as a taxable write-off at the end of the year, but you need a prescription from your doctor document. You can't just say, oh, I bought myself a smartphone and that's what I'm using it for. So that's typically the only options that I'm aware of. Now, there are granting programs out there. They're hard to come by. So like for the emergency pendants and whatnot that you can get and apply for free. But most of the time, iPads and smartphones are not part of those services. They're usually pendants for if you are having an event and can't call 911, they can hit and it will automatically alarm the 911 service in your area. Let me jump on quickly here to then talking, since we touched on the school thing here, and I know that was a question earlier. Assistive technologies in school come across in many different ways. They need to be used for adults too, but they're more commonly seen in school. The first thing is with epilepsy, if your child or adolescent, has motor dexterity issues. They can't control their hands, they can't control their arms very well. One of my favorites is typically Dragon, Naturally Speaking, which is a talk-to-text type program. That's one that a lot of schools are very easily accommodating now, where as long as your child can articulate clearly enough that Dragon can learn their speech rhythm, the computer will type what you're talking. Now, adults can use that too. The home version for that only costs $29, and it usually will come with a headset. But schools very commonly have that available for a lot of students these days. There's also keyboards, and I'm sure lower tech, older systems available. They have keyboards with bigger keys on them and bigger letters so that they're more visible. And you can now get them in multiple colors. So let's say that a person is set off by black and white on the keyboard. You can get keyboards with green lettering, with yellow lettering, blue lettering, things that can be calmer but bigger at the same time, and those are readily available on the market as well. And then we also have technologies where they have these finger gloves that allow the hands to move a little bit less, not as far, but they'll extend the fingers out of it. So the dexterity issue, the gloves themselves will help the kids reach the keys so that they can learn keyboarding without having to move the fingers as far. And those can usually be found at either assisttech.com or Costco actually has a glove out there right now. It only has one finger with the silicone tab on it, but you can add the other tabs if you want to that extend out by about another quarter to half an inch to make typing easier if the fingers can't move as flexibly. Also in schools, if you have a reading problem, you have, because of epilepsy, it's a medial temporal lobe issue or frontal lobe, the commonly see reading problems come into play. There are so many reading applications for books these days that I couldn't cover them all in an hour and a half. One that I was most familiar with is called Kurzweil. You can take any book, whether it's a book on tape or not, if it doesn't exist on tape. You can take any book that the child should be learning from, and you can scan that into Kurzweil, and it will highlight the words as it reads the text to you so you can follow along, and you can pause it, and it will show you where you paused it. But there's tons of readers out there now that are readily accessible, particularly in school environments. And there's a whole library of books on tape that cover most of the most common texts that are being used in schools these days. And those are things that can be easily acquired by the school. And,
excuse me, what was that called? Kurzweil?
Is that Kurzweil? Kurzweil. And that's the one that I'm most familiar with. They've been on the market for decades now. But there's lots of other options out there. If you just type in book to text, it should pull up tons of options. iPad has an option. Samsung with their Galaxy has an option. I believe both the Nook and the Kindle have reading programs for books that you can pick up on their system readers. So they're pretty easily accessible, but Kurzweil is one I'm most familiar with. The next thing that has become a lot better now in the last 5 years is those pens that you can scan material. So if you can't read a word, you can highlight a word with these reader pens, text-to-read pens, and it will read that to you. It can read full lines or it can read single words, whatever you want it to do. So all you simply do is wander over the words, and the little computer chip in there will read that text, and then it can say that to the student learner. So that way, if they're reading okay, but they just can't read big words, so they can't sound words out for them, be a way for them to compensate into their reading. And then one of my favorites that I talked about at the Epilepsy conference last year that has only gotten better is a Livescribe Pen, or an EchoSmart pen, Livescribe or EchoSmart pen. These are pens that actually they're a little bit bigger than an average pen, but take notes with them on a special paper that comes from Livescribe or EchoSmart. And as you're taking notes, if you get tired, or if you lose your attention, or if you have a seizure again, you miss an area of your notes, you can come back later and tap the area of the notes that you missed, and the pen will play the audio recording that was happening at the time that you missed that note.
Wow.
So what you need to fit into that. They can run anywhere between $79 to $289, depending on how much memory you have. And it does force you to use their paper.
Where did you get that from?
What was that?
Where did you buy that from? Where did you buy it?
I usually carries them. Staples, I believe, carries them. And you can certainly find them online, too. But Best Buy and Staples usually will have those available in the store. And that way, whether you're at work, whether you're taking notes from the class and the teacher, you constantly have an audio recording while you're writing notes. And instead of having to listen to the whole audio recording again, the pen actually is able to decipher what you missed, and you can tap an area that you missed, and it will play the recording that you missed at that time. So that is a really, really nice option. And some schools are recording those options. For kids, just that kids can't say they didn't get the right assignment or direction. And so that is a good option that's out in the market. Okay?
So I just wanted to ask about what types of professionals, both in the schools and at the various health systems and elsewhere, are most accustomed to assessing cognitive function and then identifying specific technologies that can help. I know occupational therapists, neuropsychologists. Can you talk a little bit about the different professionals and you know how what their approaches are to assessing cognitive problems and matching those problems with technologies?
Sure. Typically, when we're working within a school or a hospital setting, all professionals should be familiar with the idea that assistive technology is available. So the school teacher who's working with the kiddo in the classroom through the special education director, everyone should be familiar, nurses, doctors. We all know this stuff is out there and exists. That said, each specialty area tends to know more about the options that they have. So let's say you have a child who's struggling with hand, motor, arm use type things like that. Typically, that would be the occupational therapist. Now, two of our staff still teach here at a local university. Most of the programs, though, for occupational therapy are not spending much time on how to use assistive technology with clinical care, whether it's in the hospital or on an outpatient basis. They're spending more of their time, rightfully so, learning on how to try and recover or recapture the skills and help the individual learn how to better manage the skills that they have. But they will be familiar with it. Same with speech therapy. Technically, same with neuropsychology. We don't have coursework in neuropsychology at this point in time that teaches us how to implement neuropsychology as part of a rehab setting. The people that I found that know this best are typically therapeutic recreational specialists or assistive technology centers themselves. And more hospitals are, in fact, developing assistive technology centers. I know that Mary Freebed here in Grand Rapids has an assistive technology center. And it primarily focuses in on orthotics and prosthetics, but they have very quickly adapted and are starting to do more of the assistive cognitive technologies as well. You might want to talk to your local hospital to see if they have that available. But all professionals, if you're bringing your child to physical therapist, occupational speech, or neuropsych, even a teacher, you should be able to ask, my child's still not getting this, or I still can't do this. Are there technologies available that could make this easier for me? And if they don't know, hopefully they can help you research and find out what options are available.
I'd like to go back to Rusty's question, and I think that's a very good one. Why, you're talking about children. What about the adults? Do we have a chance to do the same thing? Can we go to the hospital and be analyzed and say, well, you can use this kind of machine or that machine to help you?
Yeah, and that's where you need to call to know your local hospital.
Yeah.
But that's how adults would have the easier access.
What do you tell them? What do you tell them I need?
Okay. Did you ask what do you tell them you need?
Yeah.
Okay. Typically, when you go into an assistive technology center in a hospital, you won't directly know what you need either. You tell them what your problems are. I'm having memory problems. I'm misplacing things. I can't make decisions to remember what I'm supposed to do and how to follow through with those. And they'll sit down with you, and if it's an assistive technology center that knows how to do it for cognition, they'll actually start talking about what are the options in that area of technology to help you. So you don't have to know what you need. You just have to know what your problems are, and that technology center should be the one to make recommendations for you.
What kind of a person, what kind of person would you request that you want to see? I mean, if you don't know what's happening.
That can be the challenging part. I know, for example, University of Michigan has a specific program called Assistive Technology for Cognition. So they do exactly what we're talking about.
Okay, they do have that.
But I had the hardest time finding someone to talk to about that program. It was on their website. I couldn't track down someone to talk to. And then I even asked one of the neurologists with the epilepsy program, and they weren't aware of the program. So, and when I did finally find out information about it, the neurologist was very pleased to have found this out. So even within large institutions, sometimes there can be problems with, different programs and different departments not knowing that it exists, or knowing how to access that. So you're right in that it can be challenging, but you have to be persistent and keep asking. And certainly calling us, we can call, investigate. We can check websites. We can make a few calls and see if we can figure out is there such a program and how do people access it.
And more and more hospitals and clinics and nearly all schools should have access to an assistive technology center if they're a big hospital center. And schools, I believe it's standard of practice within Michigan law anyhow, that if they don't have one themselves, that's okay. But then they need to have a contract with the school that does have an assistive technology center.
Do you think that's good? Do you think what's the name? Neurologist? Do you think if I asked my neurologist, do you think he might know about that?
I would doubt if he would know that. He or she, I'm sorry. But the people who might know in the office might be either the nurses or a tech that's working with you. The neurologists are incredibly intelligent people. A lot of times they're focusing on medical stability and medical care, not as much the rehab part of it. So usually a rehabilitation center, a rehabilitation nurse, a neuropsychologist or psychologist who focuses in rehab, and that's where the occupational physical and speech therapy tends to know more, because they're the individuals and professionals who are usually working with you in recovery and stabilization, where the neurologist is working with you in medical stability and making sure that you're as medically stable as possible. And they're usually pretty busy in that, so it's hard for them to keep up with all the assistive technology.
If an assistive technology center then, let's say they do an assessment, they recommend a technology, are they typically going to recommend a specific brand or a specific type and then be able to actually tell you exactly where to get it, or will the patient have to do a lot more of the research themselves in terms of figuring out what specific technology to use? And where do you mentioned going to Best Buy or Staples for the Livescribe Pen. are most of these assistive technologies online, or are some of them available in stores? Are some of them available through wholesale warehouses that only the hospitals have access to? I guess the question is, how do you actually end up getting the specific items that you're using?
Good question. More often than not, even if you're working with me and I recommend assistive technology, it's my job to tell you exactly where to get it and where to find it from. Right. Most of the stuff is available online or in local merchant stores. That said, if it is something special, you can get customized assistive technology. At that point in time, the hospital will be referring you to a company who will be making that equipment specifically for you and for your child. And at that point in time, you have a customized system that you'll be working. They'll connect you with that organization, and you'll be working directly with them. So if you need a customized keyboard, Dynavox has some customized versions of it. You'll actually be working directly with those companies to specialize in it. But if it's standard technology, you'll be told where to buy it and where to find it. A lot of it is available readily online.
Great. So let's talk a little bit about when you a lot of the we talked about technology being recommended by a specific professional, but if someone is going out on their own and trying to find something on the internet, for example, there's a lot of information on the internet. A lot of companies, many of them for-profit companies, trying to sell ways to improve your memory, improve your cognitive functioning. How can you tell that that's based on solid research and not just scam or trying to make money off of you?
That's a very good question. And this is hitting all of our generations. This is hitting students all the way to elderly. There are lots of programs out there. You guys have heard of these: Lumosity, Cognitive Fit, Brain Train. Wolff mentioned Brain Athlete on those that me. Mind360, Sharpbrains.com. There's several that I'm forgetting right now. Brain Connection, Positive Science. There's lots of, you're being bombarded with these things. Keep your brain sharp. Keep your brain active. At this point in time, there's no longitudinal research that has been published that suggests, in fact, that these programs, these computer applications, can, in fact, help sustain brain health or brain vitality. That said, we know very clearly that to keep the brain sharp, we have to keep using it. And it typically works better to challenge your brain in multiple different ways throughout the day. So let's say you're a person who likes crossword puzzles. If all you do is crossword puzzles day in and day out, your brain is still susceptible to losing performance or losing functioning in other areas of brain performance. And so what these websites are doing and what these gaming sites essentially have in play is they challenge your brain in many different ways. They challenge it in memory and attention, processing speed, decision-making. They make you use a lot of active processes that your brain typically, takes for granted each day, and they try to channel it into these gaming types of activities. And some people swear by them. I have lots of patients who use CognitiveFit.com. It's free, and it's one that I send a lot of my children and families to use. It's user-friendly for adults as well. But essentially, these programs are available, and they do challenge your mind. And to use those as part of any daily strategy is not a bad idea. That said, you can't be expecting that it's going to for sure help you. It's just trying to keep your mind active. One of the best things that we know that you can do to keep your mind active is to stay socially active. And that's not an assistive technology issue. That's, getting yourself out there, saying hi to people, being friendly, visiting family. But if you can't be physically active because of a physical disability, then you can go to use things like Skype, if you have a computer with a webcam, so you can still see each other and talk back and forth on the computer. And there's several free video conferencing applications that are available to still keep you socially active. And we know for sure that engages the whole brain. and now you're being friendly and monitoring memories, and you're paying attention to what's being said. And there's a lot of really good things that can happen in social interaction. And then we also know to keep the body physically active. You should be walking, you should be exercising, and eating right. Those are the 3 rules of thumb that typically will keep most of us healthy that have been tried and true for generations again. Being social, physically active, and eating well. These other programs that were mentioned can possibly help a little bit more than that, but we don't know for sure.
Right.
Does that answer the question?
Yeah, and kind of. So, in summary, really, these programs basically they can improve your function, your brain function in terms of the actual activities that you're practicing. So, if you're doing repeated activities through these programs, you're going to get better at those activities. But there's no guarantee that will then generalize and just make you more effective in terms of your memory or cognitive function in general. It's not something that's necessarily going to generalize. So it's kind of buyer beware. And the fact that some of them are free and others charge a lot of money. You might want to opt for the free ones first, at least.
Right. Yep. And the DANA Foundation also has some applications out there, too, for adults.
What was that called again? Sorry?
The DANA Foundation, D-A-N-A Foundation, has some applications out there, too, on their site.
Okay, excellent.
Well, I guess if you don't mind, I would like to explain a little more why an EEG doesn't do what you're asking. I mean, it tells you what the problem is.
Yeah, so an EEG is diagnostic technology. So that's designed to learn, to provide doctors with more information on what's going on in your brain and where seizures are starting, whether the physical symptoms you're experiencing are actually epileptic seizures or whether they're something else, psychogenic seizures, for example. So those are a diagnostic tool. Assistive technology is something that is designed to help you function. But something, that does bring up something that's kind of related to this, and that's neurofeedback. And maybe, Dr. Wolff, you can talk a little bit about neurofeedback because that involves EEG, so it involves monitoring your brain waves, but then also there's typically a video game involved where it's not really assistive technology in that it's not helping you to perform functions, it's not helping you with cognitive function, but it is helping possibly with seizure control or possibly with attention or some of those things. So can you talk a little bit more about neurofeedback?
I can, and that is something that we do at our facility as well, although it's a smaller part of our practice. Neurofeedback is a way that you have electrodes that are connected to your head, similar to what you would have if you had an EEG. In this case, though, instead of connecting multiple point leads, there's usually only 2 or 3 that are connected. Some will go up to 5. But what they're doing is monitoring your neocortical activity more often than not, the activity that's happening at the scalp level. There are 2 versions of neurofeedback that can go down and measure some white matter activity using Loretta. But what this essentially means is they're able to tell what's going on in brain rhythms. Is your brain too tired in a particular zone, or is it too active and not firing appropriately? And they'll monitor these different brain activities to see if we can get them better in balance. And to get them in balance, when you're doing neurofeedback, you will be watching a computer screen more often than not. And it is a video game, or it is boat racing, or sometimes it's pictures that slide in from each side of the screen, and it'll be like a puzzle being put together in front of your eyes. When your brain rhythms are off, that activity might be foggy, or the screen might seem like it's shaking, or the system might give you an auditory percept at a beep saying, hey, you've got to relax. And that neurofeedback technician who's working with you will be giving you feedback as far as saying, oh, you got a little bit sleepy there, are you okay? and they'll start giving you feedback on your brain rhythms so that you can start to feel like what normal is. And in that, the more you keep your brain in what's called a homeostasis point of view, the more it feels normal, the more it stays healthy, the more your brain will want to stay that way. And when it came down to the development of neurofeedback, this was developed, I think, by NASA, if I'm not mistaken, over 40 years ago now, because they had too many individuals working in the space program who were experiencing seizures from some of the gas fumes and whatnot. And so they didn't know how to protect that better, but they did figure out how to monitor brain activity to slow down seizure activity. And that's it can be used with some good effect in incontrollable seizure cases, or in cases where the seizures are not severe and the primary care or neurologist do not necessarily want to use medication, and think that there can be alternatives to neurofeedback to control that brain rhythm activity. It can be useful, especially when you're in clinical trials using it. The problem with neurofeedback that I know of is, again, there's no longitudinal research. How long does the effect or positive influence last after you stop doing neurofeedback? Some research suggests it can, last a year. Some say a quarter, so 90 days, and then you have to go through a refresher course. But right now we don't know how long the influence, the positive effects of neurofeedback can be beneficial. But it has been useful. We've used it clinically and seen good effects. A lot of those patients, they might not come back again. So we don't know. Does that mean it's worked well, or does that mean symptoms came back and they went somewhere else to try to find a different type of care?
Okay, great. Thank you.
Okay, well, again, I'm still confused as to how you come up with a remedy unless you know what the problem is.
Well, certainly you have to know what the problem is, and most often that's done through an assessment, whether that be a neuropsychological assessment or a less formal assessment. And the neuropsychological assessment will look at a whole battery of tests that will look at all different cognitive functions to help you to identify what your strengths are and what things you're struggling with. And from that, you can then determine what types of technologies might be effective. I wanted to ask Dr. Wolff, if we don't have many questions, to talk maybe a little bit more about some of the more cutting-edge technologies, the real high-tech stuff, and what's out there now, and then what's also on the horizon in terms of really novel or interesting ways to help with cognitive function.
Right. I mentioned two old school ones, then I'll come to your question on what's some of the high-tech stuff coming out. One of my favorite things to do for individuals that I work with is to get them a watch that has multiple alarms, but so that the watch also will bring up a text message that when the alarm goes off, you'll remember why it's going off.
Wow.
And so one of the options that used to be out there was the Timex Data Link watch, but they no longer make that. But now there's several watches out there, like one example is VibraLite 12, which is a watch that looks like a normal watch, and you can program in 12 different events or 12 different reminders, whether it's to take medications, whether it's to turn in your homework, whether it's to meet someone at the grocery store for an activity. And it will not only, again, set off the alarm, but the alarm can either be audible or it can be a vibration alarm. So even if you're sitting in a meeting like today, it could still go off without disrupting anybody else. It'll come up with a little text message. But it will then also do a countdown feature where if it's something that you need to prepare for ahead of time, it will do successive alarms coming down to let you know, hey, look, in 5 minutes, you have to be out the door. In 2 minutes, you have to be out the door. You should be getting in the car right now.
Wow. And
the VibraLite watch at this point in time, and there's a couple others out there on the market, also will have ones that you can record your audio message in. So when the alarm goes off, it might give you an audible message. This is your reminder to take your medication, and it can do it for you in your own voice so that you can hear it too. So if you don't want to read it, if you don't want just to remember what the alarm's for, you can actually record your own voice monitoring into that. And so I do like the watches because they're usually always on a person, if you get comfortable wearing them, obviously. that's there. And then there's also an application out there now, too, that connects like maybe a personal safety watch with a personal safety pendant with an ongoing monitoring system at home so that if you're out in public or if you're at home, you always have this care box that if you do go to a point of crisis, you're in an emergency and you cannot call, that can be connected throughout your life in multiple different formats, so you don't always have to wear a pendant around your neck. And that's the Silvercare personal safety model. They have a box, they have a pendant, they have a watch, and they're all integrated together. So it's monitoring your general health and well-being most of the time throughout your life. But I think that's pretty expensive. I think that's up there in the several $100 range. But it is certainly available. Now, some of the higher tech stuff that is coming out on the market. Some of it I think is already available, but I haven't seen it commonly used. There are smaller packs coming out that are helping to monitor ongoing seizure activity and to set off immediate alarms to emergency services in the case that you have a seizure. So you don't even have to be aware of your own activity, your own seizure activity by yourself. It will detect that through body rhythms, not necessarily through scalp monitoring, but through body rhythms, through your pulse rate, through your breathing and respiration, and it will automatically alert 911 services for you. Those are not readily available yet on the market. I had my first case with that just a couple weeks ago who had intractable epilepsy and would fall very abruptly, go flat-footed and fall, and at one point had knocked himself out. And so he had this system where if that happened again, even though he would be unconscious, emergency services would be alerted, and it had a GPS on it to let them know where to go. And so that way he didn't have to be responsible for his own care and attendant services. There's also a computer system coming out right now. It costs $2,900, but it's called an Assistive Technology computer, essentially. They didn't come up with a unique name. But it's a computer that has all the applications that cover the major domains of functioning: memory, executive functioning, attention and concentration. And it has these different data activities, similar to what we talked about. And it helps to monitor your performance. And then, with the use of artificial intelligence, it then tells you what you need to do for assistive technology support. It's kind of its own monitoring system that can develop with you. So as you're young, you might not have memory problems. As we get older, you might. And it'll start to make recommendations for you for what that computer system detects are needs for your own assistive technology monitoring. That's, like I said, it's $2,900 right now. I would say it's in its infancy, though. It's probably wasted at $2,900 for most of us at this point in time, because it still doesn't have the flexibility to know what your daily life is like. It doesn't let you type in types of activities and job skills that you need to do. So it's kind of just like you go stand down at the miter store and you want a type of shoe insert that you have. It's kind of like you stand on that thing, it'll tell you what shoe number that you need to get, and then you go buy that one. So I don't think it's right now a full use, that it will be coming up in the next couple of years. But there'll come a point where all of you who might benefit from assistive technology might have your own kiosk in your home that your computer will tell you what you need, and then it'll help you to follow through with that to let you know if you're using it effectively or not. And I think that'll probably be commonplace in the next couple of years. Smartphone applications, iPads, iPhones, smartphones for the Android are only getting better at how they can communicate and connect their technology directly with your doctor's office. With all doctor's offices now having electronic medical records, as they need to here shortly, doctors will have ways to monitor your health and well-being directly into their care systems. There are already watches and bracelets out there that a physician can send you with that will connect your heart rate, blood pressure, and things like that directly back to their office. I wouldn't be surprised if we don't see that coming up pretty soon, that we'll be able to monitor neurological activity remotely as well. So those are some things that I think are coming up on the market or in their early stages that we just don't quite know how to use them most effectively.
Right. So another type of technology that's not really assistive technology, but it's relevant to people with epilepsy is the seizure tracking apps that, and there's a couple. There's SeizureTracker.com. There's My Epilepsy Diary. And there may be a few others that are out there, basically smartphone apps, or you can have them for your computer as well, and that's a way for you to monitor or to track your seizure activity, what's happening before your seizures, what's happening during, what's happening after, and then print out. You can even print out graphs of what's happening and hopefully notice possible trends or patterns, and that you can share that information with your doctor. Has anyone tried any of those apps, or Dr. Wolff, have any of your patients used any of those?
Yeah, in our office we use SynTrend. I haven't used any of the formal seizure tracking apps.
Okay.
We do use SynTrend that comes into our office where I can, for each individual patient, I can make a specific set of questions that I want them to respond to. And so they'll click the little boxes for me on their computer or smartphone, and it will send it back to my office without them having to print anything. It just automatically goes through the internet.
Oh,
and so we use SynTrend for customizability. But seizure tracking for specific seizure type monitoring, I haven't used it, but I've reviewed the website, and it seems to be a really good option as well.
Okay, that's great. All right. Well, does anyone else have any questions? We're going to probably wrap it up shortly. So, anyone else have any questions about assistive technology for cognition, or I guess you've kind of broadened a little bit to just any kind of technology that might help people with epilepsy with their daily lives. Any other questions?
Russ, this is Karen.
Yeah.
I just wanted to bring up when I'm sitting home alone, and I know I can't remember, like what I did or what I have to do. I get on the computer, and there's like memory games where you can list down things that you have to do or you need to take, whatever, like he was talking about.
Mm-hmm.
And then if you erase it and you keep doing it, that's been helping my memory quite a bit.
Okay, can you talk?
I go over it about 5 or 6.
Yeah, talk a little bit about what specifically you do.
Okay, you can make like your own word search, or you can just make 10 lists of things or whatever, like something you need to go get at the store, whatever. And then I erase it. I'll write down my 10 things. I erase it. I give it a couple minutes, and then I try to do it again. And then I can always go back to see what was on that list to help me.
Okay.
But that's been helping me remembering a lot of things. But they have games on there to help memories of words, things that you want to do, medication, a lot of stuff.
Okay. Great.
I think it's under. Look under memory.com.
Memory.com, okay.
Yeah, because I do that quite a bit.
Yeah, I think again, if there are probably several free websites out there that have games and have things, and if you want to try those, I mean, there's no cost to it, and if it helps, great. If it doesn't help, well, you haven't lost anything other than a little time. So. I think that where you have to be cautious is where you get these programs that say this is going to change your life, and you have testimonials from people saying I was struggling, but now I'm smarter than I've ever been, and those types of things you need to be a little cautious about because a lot of them are expensive, and there's really not a lot of evidence that they're actually going to be effective at what they claim to be effective at. So.
Right.
Any other questions or comments?
Not that I can think of.
Okay. Okay. Well, Dr. Wolff, thank you so much for your time, and I certainly learned a ton today about all that's out there, and I'm going to be doing a lot of web searching to check out a lot of these different websites and technologies that you've talked about. And thank you for all the participants for being on the call. I hope this is helpful, and we will have our 2013 schedule for Learn and Share conference calls coming out probably by January. So Thanks again, Dr. Wolff, and thanks to everyone for joining us.